Hi, I'm Dr. Arland Hill with PaleoLifestyleDoctor.com. Xanax or probiotics, which would you prefer to take for anxiety? Now, when I say anxiety, we've all had anxiety. We get in certain situations that are unfamiliar to us. We can get a little nervous, a little uneasy. That's normal. But what about anxiety that's present every day and that builds up in excess for situations that really shouldn't cause you anxiety? This is not uncommon, especially when we all live in a more stressful world than we ever have in the past. Now, sometimes anxiety can become so significant that it actually manifests into full-blown panic disorders. But again, if I say to you, you have an option of a medication such as Xanax or probiotics, can we really get the same effect from a probiotic that we can from Xanax? And I'm here to make the argument that you may not get it as fast, but you may get more long-term, and here's the important part, more consistent effects on controlling your anxiety with probiotic than you'll get with Xanax. Now, what is Xanax? Xanax falls into a class of medications called benzodiazepines. The main effect of this group of medications is that they slow down the brain activity. They slow down the effects of the central nervous system and make things work at a slower pace than what they would otherwise. Makes sense, especially when you think about anxiety. As the body's being more ramped up, we want to calm the body back down too, or have the opposite effect. However, these medications are not without their side effects. Let me go through a couple with you just so you'll have a better understanding. These medications can cause drowsiness. They can cause insomnia. Paradoxically, most of the time we would think about insomnia as being awake, but paradoxically it can have the opposite effect and can actually promote that. But again, drowsiness, dizziness, memory problems, the brain not firing fast enough can be a side effect of Xanax. And then we can also have problems or side effects that we may associate or may commonly think about as with the use of something like alcohol. Alcohol is known to be a suppressant of the activity of the central nervous system. Now, the type of effects that I'm talking about here, slurred speech, loss of balance, these are things that we tend to think about with overutilization, but also long-term utilization in Xanax users, or maybe even scenarios where someone is a little more sensitive to the medication or a dose is not really accurately being utilized for that particular individual. So I tell you all that to simply say that you have an option to it. And that option is, believe it or not, probiotics. Probiotics. The simple little bacteria that we harbor in our gastrointestinal tract are what we're talking about here. Now, the first thing you have to appreciate about these microorganisms is that we have a very commensal relationship with these organisms. There's some give and take here. We give them nourishment through the different foods that we consume, and in turn, they give us different nutrients, different chemicals that benefit our body. For example, they provide B vitamins for us. All of the B vitamins in certain percentages come from the probiotics. They provide vitamin K. They provide the fatty acid called conjugated linoleic acid. That fatty acid is anti-inflammatory and helps promote weight loss. But relative to our conversation today, the most important thing that they produce is GABA. GABA is the primary neuroinhibitory transmitter. What I mean by that is it is the primary chemical that is going to calm the brain back down. Think about where we started our conversation. We began talking about anxiety. Anxiety is a state of overactivity in the brain, too much excitatory activity. We want to counter that by bringing it back down. The way that we find that balance is we bring the excitatory state down by bringing up the inhibitory activity through the action of GABA. Now, you can use a medication that does that, but again, it has side effects, or you can take probiotics and repopulate your gastrointestinal tract, and these probiotics are going to inherently make that GABA for you. There is a very well established connection now between our gastrointestinal tract and our brain. And this is just one of the mechanisms by which our GI tract has direct influence on our brain. If we don't have good colonies of these probiotics, then we're not getting good GABA production. And without good GABA production, our brains have a tendency to become more excitatory. The more excitatory they lean, then the more likely we are to succumb to the effects of chronic stress, and that leads us into that anxiety, being a little more apprehensive about different scenarios that we may find ourselves in, and even can get us to the point of having a full-blown panic attack, which nobody wants to have to deal with. So guys, here's what you got to think on this. May I need Xanax to help me get out of an emergency situation? Absolutely, guys. It's a medication. That's what medications are designed for. If you've got a crisis, an acute scenario, use the medication. But listen, these medications are not meant to be long-term fixes. Your long-term fix comes back to the probiotics and the things that you do to support the health of these probiotics. The foods that you take in, the paleo diet does a great job of nourishing the probiotics so that they can enhance the GABA production. So the foods you take in, the foods you avoid in your diet, the amount of stress that you try to reduce overall, those are all directly going to influence your probiotics. So guys, listen, you have an option. So if you're trying to balance your brain chemistry, keep the anxiety, the panic disorders under control, short term, maybe you need the med, maybe you don't, but long term, you got to think probiotics here, guys. I appreciate you taking the time to listen. Dr. Arland Hill with PaleoLifestyleDoctor.com.